What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, July 19th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Today, our main focus will be on the COVID pandemic. Hey, we're in the middle of a major summer wave. Bet you did not know that because you're probably told COVID was over or it's no big deal anymore. Let's face it, it is still a big deal. You know how we know we're still in a summer wave? The President of the United States recently tested positive for COVID, and a lot of other people are testing positive. Plus, we have new CDC data that shows COVID cases and hospitalizations are still rising here in the United States. Want to stay informed on this each and every day? Well, guess what? You can do that by subscribing to my channel down below. That's right, I do the work that the media does not do. Remember back in 2020 when COVID was pretty much the spotlight every single day from spring on forward? That's the spotlight here on my channel. We talk about COVID all the time and other viruses to keep you informed and aware of what is spreading, what's going around, and what's going on out there. Want to stay informed? Subscribe down below. Want to help other people stay informed? Many ways you can do that. Give this a thumbs up. Share this with anyone you know. Hit that notification bell and leave your comments down below. The more people that do all those things, the more YouTube is going to push this content throughout the algorithm. Alrighty, starting off today with the president and an update on his case of COVID. If you did not know, the president did test for COVID back on Tuesday, and they are providing daily updates. This is coming from his physician to the president, Kevin O'Connor. And it says at this time, we're not going to read the whole thing, but we're going to read a good chunk of this. President Biden completed his 4th dose of Paxlovid this morning. His loose, non-productive cough and hoarseness continues to be his primary symptoms, but they have improved meaningfully from yesterday. That's a good thing. His pulse, blood pressure, respiratory rate, and temperature remain absolutely normal. His oxygen saturation continues to be excellent on room air, so he's not being required any oxygen at this time. And I don't see the words saying albuterol. His last case in 2022, I distinctly remember they were giving him a little inhaler for his coughs, and it doesn't look like he's needing that this time. It does say his lungs remain clear, and now it gets a little interesting. PCR testing yesterday was confirmatory for SARS-CoV-2, COVID-19, and variant identification is still pending. So hopefully, maybe in future updates, we will hear how or I should say, what variant he happened to catch. So this is relatively interesting, and we know even prior to catching COVID, Biden has had coughing fits. We've seen it in debates. We have seen it when he speaks. We've seen it many different times. We saw him coughing quite a bit post-COVID back in his case in 2022. There was a press conference or some sort of a ceremony, and he was coughing away. So we'll have to see how he sounds when he makes his first public appearance, when he does eventually come out of isolation, which it's sounding like that might be next week. There's some rumors saying he may get back on the campaign trail. I don't know. Who knows? It's a day-to-day situation. There's a lot of conflicting reports. We won't get to the political side of things, but there's President Biden, and we wish him nothing but the best, and we do hope he gets better soon. All right, Portugal cases now. Portugal cases more than double those of last winter's wave. Take a look at this chart. Back in January of 2024, cases, they were up there. Look what's happening now. Way up there. Cases are skyrocketing right now in Portugal. Now, we're not going to see something like this happen in the United States. Yes, cases are going up, but I don't expect the United States will pass the winter wave. If we did, whoa, that would be a major red flag. One, that would be bad. Two, that would insinuate that, whoa, this is summertime and winter's going to be really bad. Probably not likely to happen in the United States, but in some countries, this does happen, and in some places, which we're going to talk about Japan now, in some places, winter The time is now, and they see higher cases now than they did back in our winter months because that's their summertime. Japan's weekly COVID-19 cases rise for the 10th straight week, and skipping over this article, we come to this from Corona Heads Up. Japan COVID cases up 46% in 1 week. Take a look at this chart here. There's two charts, and you can see here things continue to rise. The hospitalization situation continues to get worse. Last week, 8.07 patients per medical facility nationwide in Japan. This week, 11.18 patients per medical facility nationwide. That is a humongous increase, and 46% increase in 1 week for cases. That, my friends, is not a good thing whatsoever. We'll have to keep an eye on that. And it does look like, if we go back to this article real quickly, it says here the KP.3 variant is the one that's causing this wave right now. All right, moving on. Another weekly update, this time from Ohio. Cases rise for the 7th week, and this is the coronavirus update for this week in Ohio. It says the number of new COVID-19 cases in Ohio increased for the 7th week in a row, moving from 3,153 last week to 3,896 this week. Now, it's not as big of an increase as the previous week, but again, it's still a rather large one, and at a time where not many people can get a PCR test, or not many people report these at-home test, hey, that is a big increase. And remember, some people don't even test at all. Moving down here, we can see that the hospitalizations, I know they're here somewhere. Here we go. Total reported deaths, 44,030. That's up by 10. Total reported hospitalizations, again, we don't know how many active ones there are. We just know it increased by 124 this week. ICU admissions since the pandemic started, 15,831. That is up by 7 at this time. So again, cases, hey, they are going up in Ohio, as are other levels with COVID as well. Moving on now to Mike Horger's weekly update on COVID. I can tell you right now, it's not looking good. Levels are going to remain where they're at right now for quite some time. The PMC COVID-19 forecast for July 19th, 2024 expects 700,000 to 900,000 infections per day for the next month. 1 in 56 Americans are actively infectious. Estimates are worse than those forecasted last week due to a sizable retroactive Biobot corrections. So, yeah, Biobot's continuously been correcting higher. There's no reason why it's going to stop. It's just going to continue to go up until at some point we hit a peak. And mind you, just a couple of weeks from now, the college students, they're going to be coming back from their summer vacation. They're going to be going back to college. They're going to be having their parties. They're going to be having whatever they do here in just a few weeks in August. So levels will continue to go up. Maybe it'll start to peak at some point, but take a look here. His model still continues to go up in August. It does level off a little bit, but with how many corrections there have been from Biobot, I don't think that's actually going to happen. I just don't see it just stopping. I think what's going to happen is it's going to continue to go up and then eventually peak at the second half of the summer at some point. So maybe about a month from now we see a peak. I don't know, but here's what his model has. Again, goes up, levels. If you want to buy that, fine. And then in August, you can see going up again. Alrighty, moving on. We have a lot more things to take a look at. First off, the allergy map. 43% of the United States is in low to medium status. Taking a look at air quality values real quickly. If this comes up, I've been having trouble getting this to load, and looks like maybe it is going to come up. There we go. Bad air qualities on the West Coast. California. You can see orange and yellows are out there. Montana at this time, orange and yellows. Wildfire season in the West Coast and in the East. There is a lot of yellow at this time. In the central states, there's also a lot of yellow at this time. Taking a look at heat-related illnesses, expect them to continue to rise, although there has been a breather in the East right now. It's not as hot. It's only 86 degrees here today in Philly. It's not even 90 degrees. And there's indications Texas could have a break from the heat as well. Yes, surprise, surprise. So things with the heat-related illnesses may level off a little bit for the next week or so. If you want to learn more about what's going on with climate and weather, you can do so over on my other X account, at Climate Data Report, and of course on my other YouTube channel at Climate Data Report. Eventually, we will post a video on that channel. Philadelphia yesterday, 887 EMS incidents, taking a live look at what's going on in Montgomery County, and we can see here, Montgomery County, Pennsylvania, there are a few calls, including cardiac arrest right now, up in Ambler, and Chester County, Pennsylvania. Not too many calls, couple sick ones, and a few other calls mixed in between, but nothing terrible. We do know wastewater for COVID is rising in southeast Pennsylvania and northwest Pennsylvania. Walgreens this week, the national positivity trend shows that the rate is 39.2% for COVID. That's down slightly because COVID testing went up to 6,767 from 5,109. The viral activity level for COVID in Canada has dropped a little today from high to moderate. So it's now down to moderate. Flu activity level is moderate for flu A, not detected for flu B, and RSV level is low at this time. Alrighty, drum roll please. New data from the CDC. Wastewater COVID trend for the United States at this time is running high. And we can see here the number of sites that are in that dark blue, low levels of COVID, it's down to just 87. Orange, which is 60 to 79% COVID increase detected, 310. Red, 80 to 100% COVID increase detected, 160 sites. We'll go through some of these sites on Sunday, but there is one thing we do want to take a look at first before we move on, and that is this. Take a look at this. The COVID levels in the west coast of the United States. When you average up the sites in each of the states, yeah, it's coming in very high in the majority of the states in the west coast. Montana's high and Arizona's high, but look at California, very high. Nevada, very high. Utah, very high. Speaking of Nevada, we're going to take a look at something in Nevada in just a moment. Oregon, very high. Washington, very high. Alaska, very high. Hawaii is still coming in very high. And in the east, look at this. Florida, very high. Louisiana, very high down in the mid-south, as is Texas. And look at this. You can see Washington, D.C., very high. Maryland, very high. And we're starting to come into moderate in Pennsylvania. Levels are increasing in the northeast as well. New Hampshire, very high. Connecticut, very high. Vermont is now very high. Maine is high at this time. Minnesota is very high. So things are starting to spread towards the Northeast, the Midwest region as well. Still moderate in Wisconsin and Michigan, but I think that's going to change relatively soon. Now, something I want to show you from Nevada. Las Vegas. Take a look at this. The COVID levels continue to rapidly rise in Las Vegas. And there was just one of those wonky movements, but even if you take out that wonky movement, COVID levels in Las Vegas are now close to reaching an all-time high for the wastewater scan dashboard. They have never been this high before. We'll have to see what happens when that wonky movement gets corrected, but even at that, it still could remain higher than the level has ever been before. We'll have to watch it. It's going to be really close. So, yes, this is concerning. And we do know in Las Vegas right now, the World Series of Poker, I think, is coming up pretty soon. Then you have a casino that's closing. You have a lot of people flocking there. Lots of reasons why Las Vegas is relatively risky right now for COVID. And, of course, here's the big one. Take a look at COVID wastewater. It is rapidly going up in Las Vegas at this time. Very concerning. Hopefully we see this peak soon. We do know that when COVID waves occur and we start to get to the point where it's just rapidly going upward, it does indicate that a peak could be coming in the near future. So hopefully that is what we see happen there. Taking a look at the United States for emergency department visits diagnosed with COVID, and I do need to refresh this. I hope it did update. Let's see here. All right, it's saying as of July 15th, and it does look like the emergency department visits, though they're going up, it's not up as much this week. I mean, it's higher than last week, but the increase was slightly smaller. I'm encouraged by that, but overall, you get the idea here. Number of people diagnosed with COVID continues to increase, with 1.62% being the daily number, and the 7-day average is 1.64%. We will go through all of the states tomorrow, like we have been doing recently on Saturdays, taking a look at this week's variant picture, which did just update today. There is some new COVID variant data here, and the leading variant is KP.3 still at 32.9%, but that dropped ever so slightly. Why? Well, take a look at this. KP.3.1.1 is now at 17.7%. That increased pretty significantly. KP.2.3 is at 12.8%, and LB.1, which at one time looked like it was going to be a candidate to take over, is down to 10.5%. So we're really watching this KP.3.1.1 because, take a look here. You can see here, when we take a look at the graphic on the left, it's really starting to increase. And that could be a candidate to potentially be the next variant that takes over down the line. Alrighty, moving on here. Emergency department visits. Once again, take a look at the increases here in states. You can see there's a lot of oranges. There's a lot of places showing moderate to substantial increases at this time. My state, Pennsylvania, substantial increase. Ohio, Indiana, Texas, Louisiana. On and on it goes. Georgia this week, substantial increase. And I did read, we had a comment the other day. Someone said that Georgia reported a significant increase in the number of COVID cases this week. I tried to find where I could get their cases on their dashboard. I just couldn't find it, or on their Department of Health's website. If you have the source, if anyone has the source, could you please leave it down below? I would like to find that and maybe show it on video. Thank you. Anywho, moving on here now to flu this week. Not much that can be said about that. We can see here flu did not increase all that much. And COVID epidemic status. We have to show you this. Take a look. Yeah, growing in the majority of the states. Stable or uncertain in Florida. That's relatively interesting. Well, we'll take a look at emergency department visits tomorrow and see what that says for Florida. Alaska is growing once again. California still growing. And take a look at that. Washington's growing once again. Could Washington be once again rising? I don't know. Stay tuned for tomorrow's update. We did see Washington just the other day. As a matter of fact, we can pull that up. And we can see here, emergency department visits dropped by 5% this week, as did hospital admissions, but the number of people in the ICU in Washington did go up to 22. New Jersey for today, 362 hospitalizations, and when I move that in, zoom this in, we can see here, it has held steady for the last couple of days. 70 out of 70 hospitals reporting, 17 people on a ventilator, 38 people in the ICU at this time, and 59 discharges. When the number of people in the hospital goes up, the discharge volume does increase, so 59 discharges. New York State, drumroll please, I've been refreshing this all day long, and it's showing today's date here. It is showing the 19th, but again, these are the same numbers that I reported to you yesterday, so can't show you anything from New York State, and given the weekend's coming, it will likely stay that way into next week. Speaking of the weekend, I hope everyone has a fantastic weekend. Maybe you'll be busy this weekend. You won't get to see my updates. Well, I want you to stay safe. Don't do anything that's too risky because, as you're seeing here, with all the data that we have gone through today, like emergency department visits, different levels in different states, things are really high right now. So there's a higher chance that you're going to be coming in contact with someone who's positive for COVID. Please remember to mask up this weekend if you're going to any function. I don't care what anyone thinks about the mask, okay? I don't care if someone says, oh, that's over, blah, blah, blah. So what? You do you and wear the mask. In this case, yes, if you want to wear a mask, continue to do so because it will help keep you safe. Wearing the proper type of mask is important. We're going to have a piece on that coming up. I don't know when it's going to be, maybe within the next week, that will show studies that prove masking does work. Alrighty, folks, if you enjoyed this update, give it a thumbs up. Want to see more content like this? Just subscribe down below. The more people that subscribe, the more I know that I'm doing my job to help keep you guys safe and informed with what's going on. Share these videos with anyone you know. Hit that notification bell and leave any of your comments down below. I will see you all again next time. Until I see you again next time, stay safe everyone and have a fantastic weekend. Thanks for watching.